Hi, everyone, and welcome to the weekly live discussion about health. And we are on our journey for the 10 big ideas to make 2021 the greatest year of your life. I'm Dr. Bhavana Rao with Meridian Springs Primary Care. And I want to welcome today Cherie Clarke-Moore, owner of Body and Brain Yoga in Conroe, Texas. Hi, Cherie, and thank you for joining.
Oh, thank you for having me. I'm excited to be here. It's a great topic you're talking about today.
So this is week 4, and just a quick recap. We did eat, move, sleep, and this week we have Cherie here to discuss breathing.
Yes.
So I guess we can live a few days without food and water, but we cannot live without oxygen and breathing.
Right. Kind of important, right?
Yes, I guess this trumps all of the topics we've discussed so far. We breathe every second, every few seconds. We take a breath. We are doing this non-stop from the time we are born to the last breath we take. We are breathing. So let's learn to do it right. Let's learn the problems associated with breathing and how to correct them and what are the impacts it can have in your day-to-day life.
Sounds great.
All right, Cherie. So I think the first topic that is the most common one I've seen is nose versus mouth breathing. So we all know that our noses are there to take breaths and breathe in, but there's a lot of mouth breathing going on, and people don't realize that they're breathing through their mouths, and it's becoming more and more common. So do you want to talk a bit about that?
Yeah, well, firstly, I think you and I had discussed about this before, some of the problems that come from mouth breathing, right? So when you're mouth breathing at nighttime, your breath tends to be shallower with mouth breathing. And then also from inside, you're not really, the air's coming in and it's drying everything out inside. And then that kind of leaves you open to things like sleep apnea, snoring, many other conditions as well come from constant mouth breathing. But the biggest impact is on your body, right? When you're not inhaling deeply or when you're not taking in through your nose, this is where you can inhale most deeply, then it becomes a real problem. And then you still wake up fatigued as well. So, learning how to breathe well through your nose throughout the day and then as you sleep as well is really important.
Yes, mouth breathing causes a lot of issues, like you mentioned. Number one is dry mouth and dental problems. You can have poorer dental hygiene, halitosis, which is just a bad breath, and it can affect your tonsils. So a lot of orodental hygiene is involved with when you have your mouth open all the time. Plus, the air is not well hydrated when it goes down to your lungs. The nose is created such that as the air goes in your nose, it gets humidified when it reaches your lungs. And also there is the issue of pressure. So when you're breathing with your nose, you're having more negative pressure and you're able to fill your lungs better, rather than when you just mouth breathe, which is, like you said, a more shallow breath, and you're just oxygenating your top part of the lungs and not where the real exchanges happen, which is in the bottom part of the lungs.
Right, absolutely. But it can be, people don't, like you said, they're not aware that they're mouth breathing, especially at nighttime. During the day, not so much, right? Most people kind of breathing through their nose, perhaps a little bit through their mouth, but at nighttime, it's really when it becomes a big problem. So that's really important to kind of become aware of this habit. And then how do I change it? So one of the causes, I believe, or I've seen at my studio, why people breathe through their mouth rather than their nose is actually they have a lot of tension here in their chest, Bhavna. And when you have stress and tension here, you're kind of desperate to get the air in. So this is a much bigger orifice, right, to get the air in than these two little nostrils. So that's why a lot of people breathe in and out through their mouth. So that's kind of step number one to developing a really good habit of nasal breathing is, first of all, you have to kind of release the tension from your chest or any stress or worries that have been kind of accumulating during the day. So I don't know if you want me to show, but I have a really simple technique to kind of help with that, and then to be able to develop the nose breathing as well.
Sure, definitely. We'll take a look at the technique. And it's interesting you mentioned that they feel like they need to take a lot of air in, because there is something called too much breathing. Too much oxygenation is also not good. That leads to washing out of carbon dioxide, which we'll talk again later on. But that's an important aspect to keep in mind, is that you can overbreathe, which is again not good for you.
Right.
And we are meant to overbreathe at extreme exertion and not at day-to-day activities.
Right, exactly. Hyperventilation in normal everyday life is not a trait that we want. We definitely want to be able to develop that deeper, more stable, more calm breath. Absolutely. Yeah.
Go ahead, let's see the demonstration.
Yeah. So, sometimes we don't know what we kind of accumulate during the day in terms of stress. But one place where we can really kind of feel it quickly is in our chest. So one of the best exercises that I've found and that we do here at Body and Brain is just tapping your chest. So when you tap your chest like this, very quickly you can feel, oh yeah, there's some really stuffy or tight spots. Yeah, you can try too, absolutely. And then initially, exhaling with an open mouth helps you release that stuffiness. So big, deep sighs can drag up all the stuffy kind of air that's stuck in the bottom of your lungs. So you can just breathe out, sigh out. And you can do this for as long as you want, as long as it feels good. Different parts of your chest might feel different sensitivities. Sometimes people feel more out here or sometimes more in the middle. And then when you've finished, you can just simply either put your hands on your chest or bring them down to your lap, close your mouth. And you'll find actually it's much easier just to breathe in and out through your nose. But when you start, oh, I want to get the air in, I want to get the air in, right? Because you feel so constricted here. So when you feel tight here, naturally you go to mouth breathing. But once you kind of release a bit of the stress and tension, then when you finish, quite easily you can breathe more comfortably in and out through your nose. Yeah, so simple.
Definitely. This is a great, again, stress is related to breathing, and controlling your breath relates back to stress and how you can control your stress. It works both ways.
Right.
Now, this is a great technique for your day-to-day. You can do it several times a day. When you get conscious of your breathing and how you're breathing through your mouth or through your nose. And then at night, there is a technique called taping. You can get a clear tape, surgical tape from the store, and just tape it around your mouth. Um, Prevents you from opening your mouth at night. And just talk to your doctor, make sure you don't have any medical conditions that can get worsened by this. Commonly, if children have tonsillitis, adenoiditis, anything that's blocking their airway mechanically, that needs to be taken care of. And also, if people have any sorts of disorders, like this with open mouth breathing at night, they need to talk to their doctor about sleep apnea, and get tested for that, or talk to the doctor if they need any evaluations for sleep apnea before trying this kind of technique at night.
Right. Yeah, I'm very excited. I actually ordered some mouth tape to try. I was telling your husband, actually talked around, that I'm going to try it my husband first because he likes to snore. So we're going to see how that goes.
Right. Let's try on the snorers. And snoring is a big issue. So snoring is basically when your oral tissues fall on each other and collapse, and then you end up snoring. And oftentimes this person is mouth breathing. So this is where it needs to be evaluated, whether it's a upper airway problem or a sleep apnea, or causing sleep apnea. And this can lead to improved sleep too, not only oxygenation, but also your sleep quality.
Absolutely.
So another common, and then another important aspect of breathing, I think, is the way people inhale, and the way they move the different parts of the chest. So we know that we have the biggest, the diaphragm is a huge muscle that separates our chest cavity from the belly, and that is the main muscle of action for breathing. And think of it as a dome which straightens out and comes up again as you take a breath and leave out your breath. But a lot of times we are not using this muscle. We do what is called chest breathing, which is just like shallow breath moving the top of your chest. Now and there, versus what is called belly breathing, wherein the air goes into the bottom of the lungs. You're expanding the bottom of the lungs, and I think optimizing the volume of the lungs as much as you can with your diaphragm.
Right.
So what happens when you chest breathe?
Yeah. So I see so many people, Dr. Rao, that come into the studio that really, they aren't quite conscious of how they're breathing. So I always like to do a little breathing checkup with them, and I get them to count the number of breaths in 30 seconds. And usually, or ideally, I should say, ideally, it should be around 4 to about 7 breaths in 30 seconds. So if you make that into a minute, 8 to about probably 12, 14 is ideal. But sometimes people come in and they count their breath and they've done about 9 in 30 seconds, right? So actually that's showing me that they're breathing just like you said, right from the top of their lungs. So they're not using their lungs to the full capacity. It means that their body's not receiving all the oxygen and the nutrients that the lungs they pump everything around, right? Through your heart and everything.
Yeah.
So they're not utilizing their body's system well. And when that happens, when people are breathing just from their chest, things like anxiety, things like this sense of being on high alert are really high. So a lot of people who come in with anxiety, they discover, oh yeah, my breathing has a big impact actually on how I feel in terms of my emotional health as well. So it's so interesting that, we know this already, right? Our body is all one system. It's amazing how it impacts different parts. But when you're chest breathing, it really does impact a lot in your body. So how do you get deeper breath? That's kind of the question, right? So when people first start, it can be very hard when you say, okay, breathe into your belly. And there's no movement, there's nothing, right? Because they're not used to, like you said, using that diaphragm. So when I teach breathing, I always start people with chest breathing, just by bringing their hands on their chest and just focusing, first of all, on the movement of their body. So you can feel your lungs move, you can feel your rib cage move, and just allow your mind just to kind of focus there as you feel through your hands. Your hands are so sensitive, right? They connect so much with your brain. They give you a lot of information. So as you breathe, and then very naturally, your chest breathing gets deeper. So that's step number 1. So make the chest breathing deeper, number 1. And then secondly, once that's kind of mastered, I'm going to move my camera down so you can see me a bit more clearly. Then we can move from here and then come down to this diaphragm area. Same process, just feel how the body moves. So here you can feel the base of your rib cage. You can feel that diaphragm as you breathe in and out. And this really helps people become aware of their breath. Once this feels comfortable, then you can move down. Bringing your hands onto your abdomen helps you really feel and understand your breath. And then very slowly, and if you feel stuffy, exhale with that open mouth. But if you feel comfortable, just in and out through your nose. And I like to use kind of visualization as well when I teach breathing. So I tell people it's great to do lying down. Actually, if you're lying down at the end of the day, you can imagine breathing in through your lower back. So breathe in through your lower back. Feel that lower abdomen. And then exhale again through your lower back. Let it all go back out. And the more that you relax, the easier it becomes. If you're up in your head, I'm like, I have to breathe in, I have to breathe out, it makes it very difficult. That's why actually we start here first, because this helps the body relax. You can move to here, then you can move down here. By this time, if you're lying down and practicing quite often, you'll be asleep.
Fantastic effect, right? It has such an
Yes.
impact on reducing your stress. And let me recap on why this happens. Is
Mm,
because the play of sympathetic versus parasympathetic nervous systems. Sympathetic is the stress response, parasympathetic is the relaxation response. So when you are using your diaphragm and doing the belly breathing, you are triggering the parasympathetic activity. This brings down your heart rate, brings down your blood pressure, increases venous return to the heart, and
mm,
also reduces your stress hormones like cortisol. So what happens, with this? Increases your focus, increases concentration, and gets you new energy. It washes away your, say if you're doing this in the middle of the day or the end of the work day, all the stress, all the thoughts from your previous day is washed out, and then you're renewing your energy for the next activity. Uh,
absolutely.
so a lot of medical benefits with using your diaphragm, and again,
Mm,
improves oxygenation and carbon dioxide exchange, plus detoxifies. You're using your full lung capacity. So that's all the reasons you need to learn
right.
belly breathing.
Right. Actually, you're completely right there. You know, a lot of people who've come in and we've done breathing practice with have really seen reduction in their blood pressure. And that's one of the most immediate impacts, actually, like you said, that parasympathetic nervous system is flick the switch, right, between the sympathetic to parasympathetic. Your body knows what to do once it's there. It can relax, it can restore itself, it can heal itself. It brings everything back into balance, all your body systems. So you don't need to worry so much, just breathe.
Yes, and I tell my patients that all the time because they come here, I check their blood pressure and it's high. And then they look at me and they say, no, no, it's not hypertension. It is just because I've come to your office. So, okay, so let's test it. I said, okay, I can, we can consider that. So what I want you to do is take a few breaths and do some deep breathing right here, and then we'll check your blood pressure again. So if it is really anxiety related or something that, they've just walked in and they're anxious to see me, we can bring those points down by 10 or 15 points. And you can see right there whether it's like a true hypertension or it is anxiety related, or just because that they've rushed in and they've had a high blood pressure. uh,
Right.
it's a great thing to try out even at home. If anyone's checking their blood pressures, just try this
Yeah.
kind of thing. Maybe do 6 to 7 rounds of this breathing. Check your blood pressure before and after, and you'll see the results right then and there.
Yeah, that's amazing. Such great benefits, right?
Yeah, amazing. And then the third aspect of the breathing itself is the duration of the in breath versus the out breath. So you
Mm,
inhale and exhale, and then of course when we are talking about chest breathing and mouth breathing, we are doing a very rapid inhale exhale cycle. So
mhm.
I guess the idea is that we slow down and then we do a slow inhale, a longer exhale for like the ideal stimulation and ideal gas exchange.
Right, absolutely. Yeah, a lot of people think when they breathe that your inhale is the most important part, but actually it's not true. Your exhale is the most important part. So when you exhale, you are giving your body so many benefits. You're releasing all the toxins that have kind of built up from your system, and you're allowing yourself to create the space in order to be able to deeply inhale again. If you don't exhale deeply, there's no space. This is why people have short, tight breath. So learning how to exhale more deeply than inhale can be a real benefit, but it can be a bit challenging, right? We're so used to just bringing all the air in all the time. So how do we do it? So
Yeah.
I like to use kind of box breathing method to start with in terms of if you're going to count your breath. So for example, if we were to practice here, you can do something like a count of 4. You know, it's a good place to start, right? So breathe in 4, Breathe out 4. Breathe in 4. Breathe out 4. And once this starts to become very comfortable, then you can add maybe an extra second or two to your exhale. So you can breathe in 4. Comfortably and gently breathe out 6. Breathe in 4. Breathe out 6. And gradually you can start to train yourself to have that longer exhale. Something else that also helps is creating a little pause at the top of the breath and at the bottom of the breath. So being able to breathe in for 4, hold for 2, exhale for 6, hold for 2. And then you're really optimizing, exactly like you said, that gaseous exchange in your lungs. But step by step. Yeah, it's
So,
not
yes.
easy when you start. Yeah.
Yes. So I think if people are still breathing fast, such people may feel a little air hunger when they try to switch the breathing. So I think, as Cherie mentioned, it's good to be cautious. Take it slowly. Start measuring equal in breath, out breath, and then try to extend your out breath or exhale cycle more than the inhale.
Right.
Yeah. So again, when you're doing this, you're using. I think when you use your longer exhale cycle, you're really squeezing your diaphragm. You're emptying your lungs as much as you can. So when you do this, you create a more negative pressure in your lungs, so that your inhale cycle, the in breath, is very easy and filling your lungs to the maximum capacity more and more.
Absolutely. Yeah, it takes a little bit of training. It's not easy when you first start. The big thing I tell people is don't get too up in your head about it, right? If you're really thinking so much, I have to count 4, I have to let go 4, you're never going to relax your breath. So maybe initially just feel the kind of like wave movement, equal in, equal out. And then a little bit shorter in, a little bit longer out. And that way you're not so much up in your head counting all the time, because that can also add to anxiety as well, right? How many 4? What am I supposed to be doing?
Yes, and people can also break this down to 2 minutes or 3 minutes every 2-3 hours. Take a
Right.
break. Just take a break between your activities. Take a few moments to just even do a few cycles of this kind of breathing. Focus on the 3 points that just to recap. Make sure that you're nose breathing and not mouth breathing. Make sure you're using your belly, not your chest, while doing this activity, while consciously breathing, I should say. And then the inhale exhale cycle, you can use your counts to make sure you're trying to or optimizing the longer exhale and the shorter inhale. So when you do these frequent breaks during your whole day, improves your focus, improves your energy, reduces stress level. So we're not having a peak stress and then it's coming down. Rather, we are trying to keep you at baseline, or you're trying to keep your body at baseline throughout the
Yeah.
day, no matter what.
Yeah, I love that. That's such a great idea, right? Why wait until everything gets dramatic before you start implementing, right? Yeah, you can do it during the day. Actually, just being able to kind of stop for a moment and kind of be present in the moment. When you focus on your breath, it just gives you such a sense of kind of relief, right? That I'm here right now, I feel my breath, and then your stress and tension can release. So even if you're working on a project or something, that's kind of intense, that you're focusing a lot, if you just make it a habit, maybe every hour, right, Dr. Rao, you can just stop,
Yeah.
hands on your body. Why not? Just take maybe 5 breaths. Yeah. Won't take you more than 2 minutes, right?
Yes, definitely. And I think this does a lot for the physiology of your body. It keeps you calm. Not only when we spoke about heart rate and blood pressure. So when we do these exercises with breath, we are, reducing your heart rate, reducing the variability of, reducing the level of variability so that you're not tachycardic. And we all know that the lower the heart rate physiologically, your the function of the heart improves.
Mm,
And we see that athletes and people who have trained themselves really well have a lower heart rate, and then they are also training on breathing to optimize breathing, so that they can perform better. So
right.
when they do that much, if we need the same kind of training for our day-to-day activities to achieve what we want to do in our days.
Right. We're athletes in our own ways, right? Yeah, I love that book, Dr. Rao, that you were recommending for this week, Breathe. That's such a great resource. And there's a perfect example of, athletes training themselves to breathe in and out through their nose and the benefits that came from that, and how much their endurance improved. Actually, it was really interesting to read about. There's no surprise, when you think physiologically, but when you actually see the results, it was kind of shocking. You're like, oh, wow, it's really impressive.
Yes, it's ultimately going to result in better physical effects as well as mental effects.
Mm,
So that's tremendous, right? You're not
right.
reaching out for that medication, or you're not wondering you have borderline ADHD or depression, or because of the stress that the stress can cause all these symptoms. And easily workable. It's free. Um,
Right.
Breathing is free. All it takes is a couple of minutes in between your activities to
Right.
achieve.
Yeah, it's the biggest gift you can give yourself is to relearn how to breathe. Maybe when you watch babies, I don't know if you've seen a baby lately, Dr. Rao, but they belly breathe so
Yes,
naturally,
yes,
right? And as we get older, actually, our breath starts to move more and more up into our chest. So as we kind of relearn again, like, oh yeah, this is how I used to breathe when I was a baby. Yeah, you can feel a lot of benefit for sure.
yes. I remember that. I always bring it up as an example.
Mm,
Just watch a young baby, I mean, an infant breathe when he or she is laid on the bed or on a surface, is that they gently move their bellies up and down. They don't move their shoulders. They don't move their heads. That's
right,
beautiful. That's natural. And then
right.
we kind of unlearn all those things.
Yeah, it takes a long time to learn them back again, right? Awesome.
Well, could you share about your about body and brain yoga and what you do there?
Yeah, I would love to. Thank you. So we're located up on FM 1488. We're kind of by the intersection with Kirkendall, opposite the big HEB there. We're a small studio, but we are offering in-person and online classes right now. So we kind of have limited capacity for in-person. And then I also do private sessions. So they're a great option if you're looking, for that one-on-one individual attention, and if you have any kind of conditions. So for example, at the moment, I find that a lot of the work I'm doing is helping people with, anxiety or stress related to all the things that are kind of around us at the moment. And so in those one-on-one sessions, we can really help with that. And it's like you said, things like our anxiety, we can manage them ourselves just by kind of paying attention to our body and making little changes that actually have really big effects. So that's what we do, group classes, private sessions. I also do energy healing work, which is a really interesting modality as well that can help the body. Yeah, we would love to meet you. I think we have a special going on now too. If you do want to come in, we have a buy one, get one free introductory session, which is about 45 minutes just with me. We kind of do some little checkups, see where you're at, and then I give you some tools and give you an experience of the different techniques we use here too, and we can kind of hone in on the areas that you want to find benefit with.
Fantastic. If you're in the area of Conroe, please check out Cherie's studio. Her link and her address will be posted and attached to this video on Facebook. So please go ahead, do that. Really, I appreciate you, Cherie, for your help. Thank you so much for joining me today and discussing about breath.
Oh,
Um,
thank you.
very, very important topic for everybody. Please go ahead, evaluate how you're breathing. You can do small changes, by yourself. Very easy to do. So just be mindful of your breathing, and that's it. That's all you need, is just to get to focus on how you're breathing.
That's it. It's a big gift to yourself. Well, thank you so much, Dr. Rao, for inviting me on today. I really enjoyed our discussion.
Thank you, Cherie, and then we'll see you again next week.
See you soon.
See you. Bye.